guys, welcome back to my YouTube channel. It's the Red Tech, and today we will be talking about the radiation protection in the X-ray department or radiology department. Okay, so I'm gonna start off with radiation towards patients. What happens when patients come into X-ray rooms or when they go for their scans? Scans which require them to be exposed to radiation. So we know that whenever you go for your CT scan or X-rays, you are definitely going to be exposed to radiation. However, it is our responsibility as radiographers to protect you guys, or let me say patients, from radiation. So how do we protect patients from unnecessary radiation? Okay, I'm gonna start off with a simple, I hope I put this in the most simple way. We have this technique called the ALARA technique. So ALARA stands for as low as reasonably achievable, and what that means is that a radiographer should make sure that whatever they do with the patient, they do not expose them to unnecessary radiation. So how can you make sure that you don't expose your patient to unnecessary radiation as a radiographer? Okay, so your radiographer should make sure that she positions you correctly the first time so that they don't have to repeat the x-rays. And secondly, the time taken to acquire the images shouldn't be longer. So when you expose x-rays, you hear that sound, do it. Yeah, it should be as short as that, nothing longer than that. It could be shorter than that. I don't know if it's possible, but it can be longer than that. And immediately when you leave the button and the machine is not making any sounds, then you know that you've captured your image. What you can also do as a radiographer, or what you can expect from a radiographer, is having her or him collimating. So collimation is making sure that you are only including the area of interest. So the area of interest is the body part that is affected. You're not trying to have this beam of light on just one forearm. Like you're gonna cone and make sure that only the arm is included, because if you open your cones wider, then you're exposing the patient to unnecessary radiation, which is scatter radiation. So the direct x-rays towards the patient's body are not that harmful. What is harmful is the scatter radiation from that exposure. So as a radiographer, you have to make sure that you know your exposure factors, which is your KVP and MAS, and that way you won't have to repeat because your pictures are not well exposed. So yeah, these are the things that you should put into consideration when you have your patient with you. Also, if you can cover up the sensitive areas close to the area of interest. So the area of interest, remember, is the organ that is affected, that is to be x-rayed. So let's say you're doing your chest x-ray. You're going to include all your lungs, right? You're going to include your lung area. Make sure that you are able to see your lungs, and there's a little bit of space or like soft tissue on the side of your lungs to show that you didn't chop anything. And even below there, you're gonna make sure that you see your costophrenic angles. Okay, and how do you ensure that? You ensure that by centering. It's important to make sure that you know your centering points. I know with chest, this technique is famous. So your thumb will be at your, like at the tip of your neck, down below your neck. And then this one will be in the center of your chest or lung. Yeah, man, as a radiographer, you should make sure that you give your patients lead protection. By lead protection, I mean those heavy gowns that you see us wearing, usually when we go to theater or when we're helping the patient to be still and not to move, you know. Or when the parents are in the room and they need to like immobilize their child's arm or leg, doesn't matter, as long as they are not there for the x-rays, then we're gonna give them that big gown, which is so heavy and hot. But believe me, it's for your own safety. You should take that gown, and it's important that you inform the radiographer that you are not pregnant, because radiation is it's not safe, it's harmful, especially to sensitive organs. Of course, your fetus will be sensitive to radiation because your cells are still the cells of the fetus are still reproducing, and they're reproducing rapidly. So that's where radiation thrives. Hence, you need to tell your radiographer if you're pregnant. And if you're pregnant, I don't think you'll be allowed to help hold your child or like come for a casual x-ray scan like for medical purposes. No, it should be like an emergency, and that's when we can only x-ray you. Like, it should be for your own health safety. We are protecting you from a disease, and we just need to ensure that your lungs are good, maybe you've got a fracture, and we just need to ensure that the fracture does not get worse, or maybe the doctor needs to fuse the bones together so that the fracture doesn't worsen and stuff like that. So if you're pregnant, you don't just go for x-rays. And yeah, so if you're coming for a chest x-ray, I would give you a lead apron. It'll cover like your reproductive organs, your ovaries, uterus. If you're male, it'll cover your genitals. Yeah, it'll cover your genitals, and yeah, those are the most sensitive organs because they have cells that reproduce rapidly also. And other than that, okay, I can give you a thyroid shield if you're coming for an abdomen scan. So a thyroid, if the area is not exposed to radiation and you know it is sensitive to radiation, then you should put something on top. But if that specific area will be exposed to radiation, then it doesn't help to put something on top because the picture is just going to appear white. The thing is, lead garments, yeah, let me just say, lead garments do not allow x-rays to pass through. If you have a lead apron, gown, or thyroid shield, then the x-rays are not going to be able to pass through. So you shouldn't ask for lead protection of your neck if you know you're going for a C-spine scan, your cervical spine scan, because then you're not going to get any images if you have that on, you know. Yeah, that's what I'm saying. How else can you protect patients? Yeah, I think I've covered almost everything. If I forgot something, please remind me in the comment section below. Yes, so moving along, how do employers or the companies ensure that they protect their staff members and patients from excessive radiation? Okay, what I know is that when they build a radiology department, especially the x-ray room, the CT scanner room, then you need to have like lead walls. You need lead walls because remember I told you x-rays cannot penetrate lead. So even your doors should be lead lined, like your x-ray room doors. They are usually heavy. If you've been to an x-ray department, the door that we usually let the patients through is quite heavy because it's got lead in it. Like, it's a huge door, but it's also heavy on its own. It's because of the lead in it. Okay, so your employers can also protect you by ensuring that the machines are serviced and that there is no any radiation leakage. Otherwise they would have to deal with the Radiation Board of South Africa. So those machines that you see in the radiology department are monitored. They are monitored by the Radiation Board. Even like the X-ray department as a whole, they can come there whenever, or sometimes they give them dates on when they're coming to check their radiology department, if there are any radiation leakages, if their machines are regularly serviced, you know, like that's how radiology practices are regulated. Yeah, so that regulatory body is really important. What else am I leaving behind? Oh, okay. And your employers can also protect you by, like as an employee, by giving you a dosimeter. Okay, so here is your dosimeter. Is it visible there? Yes, so I can't show you the front because it's got my details. So your dosimeter is going to have your name, it's going to have the bin number, it's going to have badge number and place number, your sequence number also, and your wearing period. So this one I was supposed to wear from August the 26th up until the 23rd of October. So it's like a month. You're supposed to wear this for a month, and after that it goes away to be checked if you have received excessive amount of radiation, or like normal dose for a radiographer or a radiologist, you know, because we don't do the same job as radiologists. So I don't think our radiation amount is kind of the same. Yeah. And if they find out that you have been exposed to excessive radiation, so I've heard that you will be excused from work for like in a few days, because you need to recover from the radiation that you have absorbed throughout the month. And yeah, it's also your responsibility as a radiographer to ensure that you wear a lead apron and you put on your dosimeter. If you don't put on your dosimeter, then they won't be able to monitor how much radiation you've been getting, you know. Hence it's very important, or it's actually illegal to practice without a dosimeter, because then you'll be exposed to radiation which cannot be accounted for, you know. So that's another way of being protected from radiation as an employee. And yeah, if you're pregnant, I think they'll give you a dosimeter with an alarm. Yeah, something like that. So if you're exposed to like a little bit too much radiation, it will beep or something like that, and you can actually use that to check if your walls or doors are lead lined. That's not its purpose, but I'm just saying. I haven't used it before because I haven't fallen pregnant, obviously, but I think I've seen someone do that, and yeah. So guys, I think that's it from me. Please click a like button if you liked the video, and I'd really like to thank everyone who has been supporting me since day one. If you haven't subscribed yet, please click the subscribe button, click that notification bell, comment down below which part you liked and what did you learn from this video, and what did I forget to talk about maybe, or what is it that I did not mention that you think was really important to mention, you know. Like, just let's engage, guys, let's engage. Anyways, thank you for watching, thank you for tuning in.